we've had two distinguished speakers on telehealth. We have a third, Dr. Manish Kohli, but we're going to post that for you to look at afterwards. You know, Dr. Kohli, a physician, past board chair of HIMSS, great collaborator and friend, has some good words for us from that perspective, but we're going to move on now and go on to this great topic of vaccines. Dr. David?
I'm delighted to be joined by Rosanna on a short notice that she would address the vaccine issue from the South America point of view, and perhaps Antonio Hernandez with some words delivered from Pan American Health Organization. If I can have the next slide. Back in the early part of the year, in January, we realized that there are so many questions about what is happening with our ability to fight COVID-19 that we created an extremely nice and educational webinar with representation literally from around the world. And the concept was, what do we know? How can clinical engineer participate in this new vaccination manufacturing process and distribution? And what can we additionally do to help? Abigail from the International Federation of Pharmaceutical Manufacturing and Association join us from Geneva. And I'm going to borrow a couple of her slides. Nora was talking about the PAHO perspective, but my co-moderator, Dr. Andrew, was extremely effective in bringing the bridge between clinicians and engineers on how this new era of vaccination manufacturing can invite clinical engineers to join in support of system and ecosystem, as Jitender talked about. Marcus and Jonathan on the bottom from ECRI specifically addressed the issue of how do you develop such a vaccine and how you distribute those in minus 80 degrees centigrade. And then Dan, that you just heard from him talking about devices, actually talked about what he has done in the UK and received the Queen Order Award for his effort in fighting the COVID in the UK. Next. So the one slide that was highlighted, and I think it's still pertinent, is on the left-hand side, how you develop a virus. What the world has witnessed is the potential for what we can do when scientists and engineers from around the world collaborate and identify a virus, separate it, isolate it, and find a way with nanomolecular structure in engineering process to put it in an oily bubble so it's not being destroyed immediately upon injection to the body. And this process on the left-hand side, how to develop a virus, was a unique development and requires significant collaboration between scientists and engineers in order to be able to do the clinical trial. The Pfizer, BioNTech, and Moderna vaccine, how they actually work is described on the right-hand side, which is basically saying we have a messenger RNA, mRNA, that is sitting in an oily shell to protect it from being destroyed by the body, being injected in a small amount below the level of disease causing and entering our body cells in basically training it to identify and create antibody to fight the disease. Next. What we have learned also is that there is significant amount of perception in the public as to how safe this virus is. This was back in January 21. And what you see is in blue is the concerns for the safety and efficacy of the vaccine as expressed in public surveys. and you can see around the world significant concern. This public lack of confidence still existing. There are still people that are concerned, even though the FDA gave it full approval just recently. And the question is, how can we help in overcoming this lack of confidence and public addressing issues? Clinical engineers can do with our own publication of how do we see it from the technology side. Finally, and this is my last slide, is the question that is still remaining is, in the reference that we see, we identify that there is inequity in the distribution of the vaccine across the world, significant maldistribution. And we as clinical engineers need to hold hands together across oceans and across continents and help to make sure that the distribution is safe, equity, and reaching the appropriate need of population around the world. Thank you. And I would ask Rosanna to follow up with her message.